Hello and welcome to this baby-friendly podcast. I'm Smita Hanciles. I'm one of the Deputy Programme Directors in the baby-friendly team, and I'm having a conversation with Laura Kearney, who is the first consultant pharmacist to specialise in lactation medicine advice, and she's also the clinical lead for the UKDILAS service. And this year marks 50 years of UKDILAS. So welcome, Laura. Thank you for joining us.
Thank you for having me. Hi.
Oh, well, firstly, congratulations on 50 years of UKDILAS. So could you tell us a little bit more about that service and how it started and what you're doing to mark this important milestone?
Yeah, so the service is an NHS pharmacist-led service. So essentially we answer inquiries around medication use in breastfeeding, but we tend to sort of specialise in the more complex cases. So premature infants, multiple medications, overdosing, milk donation, that sort of thing. And we do also publish information online as well. So we have lots of guidance on the Specialist Pharmacy Services website, and also we provide the breastfeeding information on the NHS website as well. And together, between those two places, we've covered around 400 medicines. So should be plenty of information there for people. So the service was set up in 1975 by two of my predecessors who at the time were directing medicines information services and really sort of found and saw a niche for a need to provide more in-depth advice and help around supporting medication use in breastfeeding. And when the service started, it was very much aligned to supporting hospital pharmacy staff. But fast forward 50 years and we're now advising across the healthcare professional spectrum, and also anyone who's working with breastfeeding families, really. So we can help support with the issues they're sort of facing. But we've also got into other areas as well. So we're advising on policy at a national level, and also we've started to sort of dip our toes into education as well. So there's kind of lots going on. So last month, we did have a little celebration, and we just celebrated at our local trust, and there was about 40 people there who came. We had a bit of birthday cake, and we did a few games and quizzes and things like that. So that was really nice. But then later on in the year, we're going to be exhibiting at the Baby Friendly Initiative conference, and also at another conference, the Neonatal Paediatric Pharmacy Group, in November as well. So that's really exciting. And we're also hoping to launch our LinkedIn account. So there'll be details of that to follow quite shortly. Yeah.
Wow. So just a little bit then. We're looking forward to having you at the conference as well. Thank you for taking us through that little journey of how UKDILAS started and what you do. So Laura, you were also the first pharmacist to complete the baby-friendly qualification programme.
Yeah.
So I think you graduated in 2022, and at that time we were running a leadership programme and also an advocate programme. And I think at that time you completed the advocate programme. We've been on a bit of a journey with the baby-friendly qualification, and it's sort of evolving. And next year, we're actually only going to be running one programme, the Baby-Friendly Leader of Change. And I think learning from your experience and the experiences of others, and the sort of very strong link there is between leadership and advocacy, we've sort of combined things so that everyone can be part of the same programme. So I just want to ask you, what made you decide to do the qualification programme?
Well, I think as a team, we've got a whole host of pharmacy qualifications, but I really felt quite strongly as a service that's advising on breastfeeding issues that it was quite important for us to have an infant feeding qualification as well. And this is obviously an area that I'm hugely passionate about. So I decided to look into that, and obviously I came across your course. I was familiar with the Baby Friendly Initiative, but not to the sort of depth that I am now. So yeah, I thought it was really important to gain some more skills and knowledge in this area to really kind of widen my own knowledge, but also hopefully that I could pass on some knowledge to my team as well. So yeah, that's how I sort of got into it.
Amazing. And what did you enjoy about the programme, and what did you find challenging?
Well, the knowledge that I gained from the program was just absolutely fantastic. I've learned so much from it. So that was like really great. And I think the way that the course is set out, it's quite a reflective course as well. So it really got me sort of thinking about, was there any improvements that I could make to my own practice, to the service that we're delivering? And it really sort of helped me dissect previous experiences, but how I wanted to change that going forward as well. And one of my favourite modules actually in the course was where we were looking at how infant feeding, but particularly breastfeeding, was being portrayed in the media. So I chose to dissect a soap opera episode, which was really, really interesting actually, and sort of really opened my eyes in terms of how breastfeeding was being portrayed just in the general media. So yeah, I really enjoyed that. There were some challenges. It wasn't all just sort of plain sailing. I think the time to complete the course, obviously, if you're working and you might have a family that you're looking after, it was quite difficult to fit that in. When I was doing the course, it was the 6-month program still, but I think, as you've kind of mentioned, Smita, with the feedback from the cohorts through the years, that's been changed to 8 months now, and I think that's a much more manageable time to do the course in. So I think that would be great. And I think the other sort of huge challenge that I had was because I've come from a sort of non-traditional service setting, applying examples to the course requirements was sometimes a bit of a challenge because I was often having to think outside the box as well. But I think there was a lot of support from the course leaders around all of that, and also being able to bounce ideas from the other peers that are going through the course with you at the same time was really, really helpful. So in the end, it definitely wasn't a barrier at all. It was, I managed to provide some really great examples of how the course was kind of relevant to my practice as well.
Brilliant. So you mentioned there that you didn't come from a sort of traditional service setting, if you like. And I guess what you mean by that is that the settings where we have baby-friendly standards, there are people implementing baby-friendly standards in those services, such as maternity, neonatal health visiting. And we're really keen that other professionals like yourselves who are very relevant to infant feeding also complete the programme. So we have actually made adaptations to make sure that you don't have to think outside the box as much and that, the questions are equally relevant, and also that those that participate in the course will be able to benefit from networking with each other as well and thinking things through together.
Yeah.
So I'm just thinking, since completing the programme, how has it enabled you to lead on aligning your service, your non-traditional service, if you like, to the baby-friendly standards of care?
Yeah, well, I think although I did the advocacy course, it definitely taught me leadership skills. And it was from doing this course that I had the idea of, hang on a minute, I could maybe actually align our service to these principles. So, and I don't think if I had done the course, I'd have ever come up with that idea. But I think the course itself, with the knowledge that delivered, and you do dive into kind of the evidence base behind the standards and how that's improved breastfeeding rates and patient care, it became a sort of much easier sell, if you like, to my sort of seniors as to why this was a great idea and it's something that we should embark on. So I did get support in order to go through this program as well. But yeah, I think the knowledge from the course just really helped me understand what we needed to do in order to hopefully improve our patient care going forward as well.
Great. And how do you feel that the qualifications supported you to influence others in relation to infant feeding?
Yeah, so as I said, I think I've definitely learned some leadership skills from the course, and the knowledge that I gained just enabled me to provide that sort of compelling argument as to why this was hugely important. And also, I think the BFI website itself is really great because there's loads of tools on there which just really helped me to sort of navigate through in quite a methodical and robust way as to how I was going to actually approach what we were going to do. So yeah.
Okay, brilliant. Have there been any sort of successes or challenges in trying to align your organisation with baby-friendly standards?
Yes, I would definitely say so. Yeah, I mean the successes have been great. We kind of surveyed the team before we did any of this work, and their improvement in the knowledge around all of this has just been, you know, sort of outstanding in terms of what they now understand and the importance, and also the sort of impact that our advice can have on that onward feeding journey as well, which I think is something that we now, you know, really sort of understand in much more depth, and it's allowed us to provide much more holistic patient care as well. So we went through a process of aligning with the standards, and what that involved was actually we first had to kind of work out which service we were most aligned to. So obviously there's a set of standards depending on the service delivery, and we went through a mapping exercise of, well, which one did we most closely align to, and that sort of came out as it was either neonatal or community services. And as we did a bit more of a deeper dive into that, we sort of decided that community services was the best fit. And then we sort of had to decide, are we going to use everything that's available on the BFI website, or do we kind of come up with some sort of amalgamated neonatal community service tool ourselves? But in the end, we decided it made much more sense not to reinvent the wheel and just take on board the tools that are available. So we decided that we would go for the community service set of standards and align ourselves to that as much as possible. It's obviously been very time consuming going through all this. And again, you know, we're not mapping exactly. There are definitely parts of our service delivery which do not come into the standard set. And, you know, I think that's okay. I think it's okay to be transparent and open about that. And I suppose that feeds into one of the challenges, which is that actually we know that we can never become accredited like a traditional service. So, you know, what was the gain for us at the end? Because we're not going to get that kind of nice certificate at the end or recognition. But I think it was still very important to us as a team, having understood the evidence base behind it all, as to why this would definitely lead to better outcomes. And we've done a sort of few in-depth spin-offs of the standards as well. So an example of that is we've done quite an in-depth piece of work on the advice we're issuing around safe sleeping. And it's a post we're taking to the conference actually this year. So obviously there will be people who are on sedating medicines in breastfeeding, and issuing safe sleeping advice wasn't advice that went hand in hand that we were issuing, you know, consistently. So we've looked at things like, well, what even defines a sedating medicine? What advice are we going to issue, and when do we issue that? So we've done a piece of work around all of that. And again, the improvements in our service delivery in terms of where we were when we were issuing this advice to where we are now is an incredible improvement again. And again, that's all been hinged around the BFI standards, sort of providing that sort of scaffolding to help us improve our service delivery as well.
Great, amazing. Really interesting that you've decided to sort of take our community standards and think through that. We've recently revised those standards as well in order to support that joint collaborative working between early years services and health visiting services. So there's sort of a combined set of standards now, but we also know that those implementing baby friendly are also starting to work more closely with other health professionals, either nutritionists, dietitians, speech and language therapists, perinatal infant mental health teams. And we're really hoping that, like you, who've managed to sort of think of ways of aligning practice with the baby friendly standards, that other relevant professionals and services will also be able to do the same. And I'm just thinking, from your learning and from your point of view, has there been any other wider impact that you've seen from having completed the programme and the work that you've undertaken that you've just outlined?
Yeah, so with the BFI standard alignment process itself, we kind of buddied up with a neighbourhood service in community who are accredited, and so it's been really great kind of learning from their experience as well, sort of helping us through this. So there's a lot of collaboration between this sort of group, and we've provided them with education and vice versa. But I think the other sort of major thing that I definitely wanted to mention in today's conversation was how the course really opened my eyes in terms of the lack of pharmacy undergraduate education that we receive around infant feeding. And I guess you can't know what you don't know. But after going through the course, it was just actually quite shocking, like the actual evidence gap that we have as pharmacy undergraduates. And that's not filled anywhere else postgraduate wise either. And so I think there is a gap that needs to be addressed there. And it's not just about medicine's use in breastfeeding. Obviously, that's hugely important. And there's a lot of re-education that needs to happen around that as well. But that's often, if there is any breastfeeding training that's given undergraduate wise, that's what the focus will tend to be on. But the course certainly opened my eyes to the much wider issue. So I think pharmacists need to know about good formula choices, the overdiagnosis of allergies, and there is no training whatsoever on the WHO code. So me going through the course, although I had a bit of an awareness of it, it's going through that actually kind of gave me that depth of knowledge to obviously train my team and sort of realise the evidence gap more widely amongst our profession as well. So yeah, that's definitely something we want to address and we're working on at the moment.
I guess you don't know what you don't know sometimes.
Yeah,
Yes.
yeah, exactly. Yeah.
And probably pharmacy is not the only profession that needs some knowledge of infant feeding, but doesn't have that yet. So what you're making me think about is one of the reasons that this program got started was to build capacity in infant feeding leadership and advocacy. And some of that advocacy is around the gaps in education in infant feeding for the professions that need it. So yeah, thank you for highlighting that. That's really encouraging. So do you have any top tips or advice for those that are considering applying to complete our qualification program?
Yeah, I think when I started looking into it, I was kind of like, oh, should I, shouldn't I? And I'm really glad I did. So it's just gone on to such amazing things for us. So definitely just go for it. If you're thinking about it, go for it. It's a really great course, and the learning that you get from it is absolutely fantastic. And even if you're not from a traditional infant feeding setting like myself, it's still highly valuable, highly relevant, and it can really get you sort of thinking about how to improve things in the future, and embrace the experience as well. Learn from your peers. You're going to be exposed to all sorts of people from different backgrounds, and the course leaders are really supportive as well. So it's just a sort of great networking opportunity as well.
Oh, well, I'm really pleased to hear that it's had such benefit, and that and thank you that you've enjoyed it, and it's been really lovely to hear about your experience of all the things you've done since. What's next for you now then, Laura?
Well, I think for me personally, I might take a little break from qualifications. Because the consultant portfolio was quite demanding as well. So yeah, we'll see. I'm not ever going to say never, but in terms of the UKDILAS service, I guess we're sort of thinking about, well, what's next for the next 50 years? And I think we're really proud of what we've achieved, where we've come from, where we are now. But there's definitely more things that we would like to do. And the education, as I mentioned, that's definitely becoming a bit of a sort of my baby, as it were, trying to sort of influence and make change with the universities to try and engage them in, perhaps changing their education delivery that they have. And also, we'd very much like to get into research as well. I mean, that's definitely one of the pillars of practice of many healthcare professionals. And as a service, we have a wealth of information at our fingertips, and I think we do have a great opportunity to sort of answer some questions which haven't yet been sort of solved. So we're definitely going to sort of start getting into research a bit more, I think.
Yeah, so watch this space.
Watch this space, yeah.
Well, it's lovely. It's been lovely talking to you. Thank you for taking that time with us, Laura, and all the best with UKDILAS. And I hope you're going to continue the celebrations.
Oh, thank you so much, Smita, and thanks for having me.